Is there kind of a link between mental health and people with ADHD?
There's a really high comorbidity for people with ADHD and experiencing mental health problems, whether that's low mood, anxiety, burnout, and low self-esteem. And it really makes sense when you think about some of the different symptoms of ADHD and how that can manifest. It's understandable why you would have a sense of anxiety.
Welcome back to Patient in the Room. Today, I'm really excited about this conversation because we're going to be deep diving into ADHD. Today, I'm joined by Dr. Bradley Powell, a clinical psychologist who specialises in neurodivergence, particularly ADHD. Bradley, welcome.
Thank you for having me. It's a pleasure to be here.
Let's clear something up because the internet has so many opinions on this. What actually is ADHD?
Well, ADHD is a neurodevelopmental condition. And typically, ADHD has an onset prior to the age of 12, and ADHD needs to be present in 2 or more settings. And when we think about ADHD, often you think about inattention, so maybe difficulties focusing, possibly difficulties with organizing, forgetfulness. There's 9 key symptoms in the inattention domain, but there's also hyperactivity and impulsivity, and there's 9 key symptoms there. That could look like being constantly on the go, needing to do things. In a young person, it might look like running around, climbing up trees, things like that. But also impulsivity in speech. So it could be finishing other people's sentences, or maybe answering a question before the teachers finish the question. But ADHD is... when we think about the impact of ADHD, it goes beyond that as well. So often people report time blindness or financial impulsivity. When we think about ADHD, this is often what we call the ADHD tax. So the forgot appointments, the missed time, the uncancelled subscriptions. And when we think about ADHD from the standpoint of the brain, it's a bit like the brain CEO is running low on the fuel that it needs. And that fuel is dopamine and neuroepinephrine. And when dopamine and neuroepinephrine are lower in the brain, it can cause specific symptoms for, each unique person. So that could be forgetfulness, that could be inattention, but ADHD also comes with real strengths. And some of the people that I see, the best brains are the ADHD brains, the creativity, the drive, the high energy. And so ADHD does come with some differences, but there's also so many strengths that come with it.
I love that you touched on the strengths of ADHD as well as the kind of like differences. So for someone who is thinking, maybe I do have ADHD, they maybe have some of those signs and symptoms, what's the assessment look like, and who would they go to for that?
So typically for the assessment, there's a few different key processes that need to take place. So usually there's a screening. So in an adult, that might look like the ASRS, and for a young person, that might look like the SNAP questionnaire. For a young person, we would want to get that screening completed by a parent and a teacher, maybe the young person too. For an adult, usually it's fine if the adult themselves completes the screening, but if you want to be more thorough, then you could also have a partner complete that. And that looks at some of the key symptoms and also the degree of impairment caused. And when we think about ADHD, it's not just about having certain signs or symptoms, there also needs to be some sort of impairment. However, impairment is unique to each person, and people develop compensatory strategies or masking, which we'll touch on. So once the screening has taken place, you have a detailed evaluation. So one of the tools that we use is the Diva-5 or the Young Diva. And with that, you go through each of the specific symptoms of ADHD, and you're looking at whether that particular symptom is present in two settings, and was it present in childhood. So for example, you might ask a question, do you have difficulties with organization? Okay, what about at work? Was that there in childhood? And you want to go through each of the symptoms. And for an adult, they need 5 symptoms in either inattention or 5 symptoms in hyperactivity, impulsivity. And if they have more than 5 in both, then you can say it's the combined type. But if it's just 5 symptoms in one and 3 in hyperactivity, impulsivity, it would be predominantly inattentive. When we do the evaluation, it's really important to gather lots of other information. So I always ask a person, okay, what are you good at? What are you into? But you also want to find out about their work, education history, any mental health history, caffeine intake, because we know caffeine can be more addictive for people with ADHD. So you want to find out drug history as well, because drug use and substances can also be really addictive. We also use tools such as the Conners. So that's a validated questionnaire. It goes through lots of symptoms, and the person would complete it, and also an informant. If it was a child, it maybe would be the parent themselves and the teacher. Sometimes we also use a continuous performance task. So that's the QB check is one example. And that's where you sit down for 15 or 20 minutes and a dot flashes on the screen, and you need to press the spacebar when it's 2 of the same dots. And that measures, it's a really great tool because it measures eye movement, so your hyperactivity, but it also measures where you make an error, either an impulsive error or your slow reaction time. The Diva 5 is a really great tool for assessing ADHD because it also looks at the degree of impairment caused, but it also understands that sometimes impairment is compensated. So that could be through lots of exercise. So if someone is exercising all the time, they're on the go. They are on the go, but their exercise is a way of coping with some of those symptoms. Likewise, impairment may be reduced if someone relies on lots of tasks, to-do lists and things like that. So actually, people can develop coping strategies to make that impairment less obvious to some people. Often what we see is if ADHD has been missed in childhood, which often it can be because school can be quite structured and things are done. But when you get to adulthood, maybe there's a big life transition. Maybe it's a promotion, starting a family. These life changes can lead to the strategies that once helped falling away. And then you might start to think, oh, maybe I have ADHD. And that's often when those life transitions happen, that's when someone might start to question whether or not they have ADHD. In terms of how to get assessed, you can go to the NHS, but some services have quite long waiting lists, so people do go privately as well. It's really important that you seek an accredited professional, either a clinical psychologist or a psychiatrist or some other profession who has the experience and expertise and the training required for assessing ADHD.
Sounds like it's quite an involved process. Like it's not just the person who is going in to potentially get diagnosed, but family members, loved ones kind of also get a look in at that assessment as well. How important is it that the family members are kind of supportive in that assessment period?
I would say it's an essential piece of the assessment, especially for a young person, because someone might be presenting with ADHD-like symptoms at home, but if they're not presenting at school and the teachers aren't spotting any signs and they're not providing that support in place, you might start to think, well, is this ADHD or is this something else? And it's really important when you do the assessment that you consider their psychiatric history and the differential diagnosis. So you want to understand, okay, is this inattention or is this hyperactivity, difficulties organizing or with memory? Is this caused by, for example, anxiety or ADHD? And the way that you are able to understand that is by thinking about what came first, and is there a specific trigger for the depression or the anxiety in, for instance, if something happened in someone's 20s and then these symptoms appeared, you would be able to say that actually maybe a good differential is the depression or anxiety. But if the signs of ADHD were present before that, you can be more confident that it is ADHD. And that's why the informant is so important, because actually it's really hard. If I was asked, okay, what's your developmental history? What was your birth history? To be honest, I probably wouldn't be the best. Wouldn't be the best historian there. So that's why having a family member providing that collateral information is really important. Of course, there are cases where that's not always possible, but it's a really important piece of the puzzle.
And from your experience, what are some of the most common signs with someone who does have ADHD?
It can be quite unique to each individual. I think if we think of the stereotypical example, it might be the young boy swinging on a chair, always talking to his friends. But often, these are such fast brains, able to complete the classwork really quickly. And then, okay, right, I can talk to people. There is also more of an underdiagnosis in females. So actually, it's quite easy for young females to get missed because they might be looking out the window, not really causing any trouble as such. So those signs can be missed. But when we get to adulthood, there's certain tools that you can use to pick up female-specific symptoms, and one of those tools is the SASSy. Some of the other common signs that we might see could be forgetting appointments, or maybe it's not forgetting appointments, but it's difficulty scheduling the appointment. And this is a real problem when you think about the ADHD diagnosis process, where you need to fill in forms, multiple forms, you need to book several appointments. So difficulty scheduling appointments. It could be real difficulty getting things done, whether it's knowing where to start or procrastinating things. It could be losing your keys, where's my wallet? But also other signs could be, spending lots of money and maybe not thinking about the consequences, or getting really focused in on something and then deciding, actually, I don't really like this, whether it's a sport or an instrument, and having difficulty following through on that practice of whatever it is. It's really important to understand some of the signs that could be missed. So if ADHD isn't diagnosed, there could be a lot of impulsive risk-taking and accidental risk. So this could look like speeding tickets, impulsive driving, or certain risky behaviors. And I think possibly some of the riskier things could be more obvious in men, potentially, but not always. There can be other consequences that can happen across genders.
One thing that really hit me when I was researching ADHD was that kind of masking. So wanting to look like everyone else while not feeling like everyone else. Can we kind of talk a little bit about masking, why it happens, and how it happens for people as well?
Well, I think when you think about masking, it's a really understandable response to if you're feeling a sense of difference from a young age, and perhaps you're doing things which are maybe commented on by other people or by teachers. Naturally, as humans, we have that desire to fit in. So we may develop strategies to fit in, but that might perpetuate that sense of difference, and also can contribute to some mental health challenges as well. Also with masking, if someone is very active and they feel a need to move about and fidget, but they're told off for doing that and they stop doing that, actually fidgeting or movement is a really helpful regulation strategy. So by really trying to stay still, that might be counterproductive for a person with ADHD. There's also different ways that people might mask. So I touched on, doing lots of exercise. But one of the things which is quite interesting with ADHD, often people might not realize they have ADHD, but what we know from research is that nicotine actually has a real effect on focus, not to the same extent that medication has, but sometimes people can become highly addicted to nicotine. So it's more addictive for people with ADHD, and that can become a tool that people rely on. Other ways of people masking could be things like, I suppose maybe someone wouldn't consciously know that they're masking, but if someone always feels the need to be doing something, they might be talking to people more at work. They might be going to the water cooler more. They might be getting up and having a lunchtime walk. But there's also overcompensating and masking. So if someone is falling behind on work, and you don't, there is maybe a bit of shame and stigma associated with that. So rather than saying, I'm really struggling to get this work done because I've got so many different ideas and there's lots of projects, or maybe I'm not just feeling it, people might mask their ADHD by working excessively at nighttime. And this comes at a great psychological and physical toll, because if you are spending your evenings working, maybe not sleeping as well, distancing yourself from your hobbies, your loved ones, then over time, that way of masking can lead to things like burnout.
And I feel like as you're kind of saying that, it sounds like it could be really, really exhausting to kind of constantly have to fit into a world that maybe doesn't feel like it's actually built for you. Do you find kind of when you're going through that assessment period with people and you're talking to people with ADHD that that's something they struggle with a lot?
I think definitely, especially if it's in later adulthood when that diagnosis is taking place. Finally, my life makes sense. I understand why this has all happened to me. And I think that's why spotting ADHD in the teenage years or in childhood is so empowering, because you're able to start shaping the narrative that is helpful for that young person. And I think when you're able to find someone's passions and their interests and their strengths, and you can map those onto, okay, well, maybe this is because of ADHD. This is why you are really creative or really good at that thing. Okay, you can recognize there's certain challenges which are difficult, but we can find tools for those. And I think when you are with a young person and you find out about what they're into and you're able to find some sort of role model who has ADHD, you're able to say to them, you're in the same club as this musician or this person in society. Isn't that great? They've achieved that and their ADHD has been such an asset to them. Maybe you can achieve that too.
I love it's like that turning that potentially negative narrative into such a positive, empowering narrative for people and, celebrating the differences that we all have. Something I'd love to touch on is burnout with people with ADHD. Speaking personally, like I've definitely had phases where I've just been like in focus mode and I've been like, right, I'm going to get this stuff done. And then, come Wednesday, I am so just feeling so burnt out. I'm done. How can I feel less like that? How can I kind of pace myself a bit better?
It's really tricky, isn't it? Because when you're in that focus zone, you almost don't want to let it go.
Yeah, definitely.
You're achieving so much, but often what can happen when you're in that zone of focus is, oh, I haven't had my lunch break, or I haven't done these certain things. And when that happens, there's a cumulative toll, and that's where the burnout occurs. So I think it's about being intentional about those micro resets. So even though you're in that state of complete focus, sometimes a micro reset is enough to turn the stress system off, stop the cortisol being produced for 1 minute. And that micro reset could look like stopping for a drink of water, taking a deep breath, getting up and stretching your legs. And the added effect of those micro resets is beneficial and enables that long-term performance. I think some of the other things to be mindful of are often when really focused on a project, you can start slipping away from the things that really matter to you. So whether, for me personally, I love spinning. And I know if I'm really dedicating myself to work and then I haven't done my spinning, actually, I start to feel quite, flat. So that it's having that awareness of, okay, well, if I keep on down this path, it might not be sustainable. So I need to take a break and do something. Sometimes it's really helpful to schedule in reminders of, okay, this is my lunch break, and having someone who can help you stay accountable. So booking in a lunch with someone else, so then you've got to leave the desk and have lunch with someone. But also I think burnout is a really tricky thing to navigate, and often adults might not realize that they have ADHD, but they are working around the clock. They've fallen away from their values. The pressure is so high, and that's where coming into the therapy room for burnout, and often we would complete a screening tool for ADHD, and if ADHD is present, that's where tools can come into place, which actually really help someone, whether it's CBT for ADHD and focusing on some focusing strategies or time management strategies, or even medication. Sometimes the reason why someone burns out is because they're really struggling to focus throughout that whole day. So medication can be a really helpful tool for people as well.
So what is the role of medication in ADHD then?
So coming back to that idea of the brain CEO, the prefrontal cortex, which controls organization, planning, impulse control, if it's running low on dopamine and norepinephrine, that's what can cause some of these ADHD symptoms. So medication, there's a couple of different types, and I'm not a psychiatrist, so I'm not an expert on the medication, but the way that it works is by increasing the uptake in the brain of dopamine and norepinephrine. And when the brain CEO, the prefrontal cortex, has the ingredients that it needs, the fuel that it needs, it's able to do some of the things that it finds difficult. And it doesn't always mean that things are going to be easier forever. Sorry, let me rephrase that. Taking medication doesn't automatically mean that some of these things are going to disappear, but it is going to make, in a large majority of cases, a lot of things much easier.
So when would you be kind of looking at putting someone with ADHD on medication, or is that kind of something you try to avoid?
I think it's all about the person's choice, and that's how evidence-based practice works. It's about knowing what the research evidence says, and the research evidence does say that it is really effective. But if someone doesn't want to take medication, then that's their choice, and they shouldn't be forced into taking medication. But if they are wanting to explore that and they think that it could be helpful for them, then I would refer them to a psychiatrist to discuss the pros and cons, what that process could look like, and find something that works for them. And they would always have, in the initial medication period, they'd have follow-ups with that psychiatrist or pediatrician to make sure that it's working how it should be. And it's really important when someone starts medication, and you want to assess this when you do the ADHD assessment, whether there's any history of heart disease or cardiac disease in any family members or any heart problems, because medication can also have some side effects on the physical health.
And so I'd love to kind of steer the conversation into mental health. Is there kind of a link between mental health and people with ADHD?
There's a really high comorbidity for people with ADHD and experiencing mental health problems, whether that's low mood, anxiety, burnout, and low self-esteem. And it really makes sense when you think about some of the different symptoms of ADHD and how that can manifest. It's understandable why you would have a sense of anxiety if you have forgotten an appointment, or if bills are piling up and you're avoiding opening letters. It makes sense why you'd feel anxious about that. But there's also the aspect of where someone is, for example, if there's a child who has ADHD and they're told off by teachers saying, you're not focusing, stop moving, stop tapping, and having that sense of difference from a young age, feeling like you don't fit in, that sense of difference can manifest that sense of difference can make you feel like you're not good enough, particularly when you've received those messages. And that's why it's really important to identify ADHD early, because you're able to work with teachers or employers and put in reasonable adjustments, whether that's allowing some sort of fidget, whether that's enabling extra time in exams, because of course, if you are taking longer to complete an exam and you don't have extra time, of course, that's going to make you feel bad and make you feel like you're not good enough. So often many adults may come to therapy not feeling good enough, and we're able to use cognitive behavioural therapy. So that's a really evidence-based treatment for a range of mental health conditions, but also ADHD. And we're able to reframe and update someone's beliefs about themselves and start gathering evidence that they are good enough, and making sense of that story of their past, and helping them write a new future as well. And
you kind of mentioned cognitive behavioural therapy there. Can you just tell me a little bit about how that works and what that is?
Cognitive behavioural therapy, the main idea is that the way we think about a situation influences how we feel about it, and also what we do. And we can get caught in certain thinking traps and ways of behaving which make us feel worse. With CBT, it's a very goal-focused approach. So usually what you would do is you would come into a session, and the first session is really a conversation where you get to know the therapist and you start to explain a bit about a recent example of what's been happening and understanding how the thoughts, feelings, behaviors, maybe early experiences are interacting, how certain early experiences have maybe caused certain beliefs about yourself, and through CBT, so it can be quite structured. So you would follow, so with CBT, it can be quite structured, and there's certain interventions that you might use. So, for example, bringing awareness to one's thoughts is one of the first steps. So asking someone, okay, when you're in that situation, how were you thinking? And in an ADHD perspective, it might be, oh, I was thinking I can't get this done, I can't focus. And when you bring awareness to that thought process, you're able to start saying, okay, well, let's try and think in a different way, a more helpful way. It's not unrealistic optimism. It's about thinking in the most accurate and helpful way. So often someone might come out of a meeting and they think, oh, I performed so poorly there. And you don't necessarily want to say, no, you did amazing, but you want to get the facts and the evidence. And often the way that our brains work is that we jump to the negative and we think the worst in a situation. So when we pause, we recognize how we're thinking and we look at the evidence, actually we're able to think in a more helpful way. And the tool or the technique for thinking in a more accurate way is easily remembered with 3 letters, 3 C's: catch it, check it, change it. You want to catch the negative thought. You want to check whether or not it's true. And if it's not true, then you want to change it into something that's more helpful. And when you do that, generally it makes you feel a little bit better. Sometimes we might also do something called behavioural experiments. So doing things in a different way in order to find out how, doing things in a different way to change how you think or feel in a situation. So for example, someone might not apply for a job because they think that they're not good enough, or they'll get rejected and they won't be able to cope with it. So you would set up some sort of experiment where you say, okay, well, let's go and let's see what happens. And actually, if they do get an interview or even the job, you're able to say, well, actually, what does that say about the way you're thinking about that situation? So it's a collaborative, goal-driven approach, which is evidence-based for a range of psychological problems.
So touching on goals there, I feel like there's different types of goals. There's like the feeling goals where it's like I want to feel more confident in these situations, or there's the kind of like I don't know, factual goals, I guess we can call them. It's the I want to achieve this set thing. Does that approach kind of work for both of those types of goals?
Well, usually when we set goals, there's research which shows that when goals are specific and measurable, that's where they are the most likely to be attained. So that goal of feeling more confident, sometimes it can be quite hard to work out, okay, well, if you are feeling more confident, what would that really mean? And there's ways of measuring it with a questionnaire. Okay, how confident are you now? And then at the end of your therapy, are you feeling more confident based on this questionnaire? But usually what we want to do is think about, if you were feeling more confident, what would you be doing? Okay, maybe I'd be contributing more in meetings, or I'd be speaking up more, I'd be going to parties. Okay, so once you've worked out what that specific goal is and you can make it measurable, okay, maybe I will go to that party, or I will contribute in the next meeting. You're able to track progress towards them. Often the best way to think about achieving a goal is thinking about your identity. So it's not just about the behavior, but it's about who is the type of person who is going to achieve this type of goal. So I am the type of person which is going to speak up in a meeting, rather than I'm someone who stays quiet. And when you tie a goal into someone's identity and why it's valuable and important to them, that's more likely to generate goal-driven behavior. It's really important that you think about goals from a long-term perspective as well. So if it is a 3-month goal, you're able to work backwards and think, okay, if I want to be in this place in 3 months' time, what do I need to be doing each week? So you can set yourself micro goals for each week. This is what I need to be doing each week in order to do that. And this is where therapy is really helpful, because you're able to check in each week and see, okay, did you reach this mini goal this week? And if you didn't reach that mini goal, why not? And then you're able to problem solve any barriers or hurdles and address them. Often it's really helpful to schedule those tasks or those goals into the calendar, because we know if we schedule a date and a time for something to occur, it's more likely to happen. I find it quite helpful to actually write the goal in that first person perspective. So for example, in 3 months' time, I have achieved this. And when you write a goal in the first person as if it's already been achieved, it's more aligned to that identity, and you're going to drive more of those behaviors which are consistent with that identity.
I feel like that really kind of plays into maybe that kind of like dopamine boost, you know, like that achieving small kind of goals on the way to the bigger goal, which would probably help with an ADHD brain as well.
Definitely. I mean, there's something around, if you have a range of tasks to do, rather than saying, I need to submit this big report or this one project, when you break down each of the steps of that task and you tick it off one by one as you go, that does give that sense of dopamine. And it's really important to tap into that sense of competition. And often many people with ADHD do have that competition. They want to be the best. And if you tap into that competition and say, okay, well, how quickly can you get that done? Let's really work on this. It drives more of that goal-driven behavior, because it does feel better.
Yeah, I find I have little mini lists everywhere, and I love like ticking off one from each list. And but are there other kind of ways of getting things done with ADHD other than like list ticking or things like that?
A really helpful tool is body doubling. So if you know that you need to get something done, it's about, okay, well, who can I do it with? And maybe you have a call or a Zoom, and you don't necessarily need to be talking, but it's just about, we're going to work together for this set amount of time to get this piece of work done. And if it's also about thinking about what does the person find difficult? Is it a desk which is quite cluttered, or is it by the window, and are there lots of senses of distraction? So it's about clearing away that distraction. Sometimes having music is really beneficial, because music can give that sense of dopamine. It's something to focus on. And also using Pomodoro timers. So that taps into the competition. Okay, 25 minutes or 50 minutes, I'm really going to work hard. Then I'm going to take that 10-minute break, reward myself, tick it off the list, have a cup of tea, then I'll go back to it as well. So those things can be really helpful. And it's about thinking about two ways of making change. So change from the outside in, so that's changing the environment, maybe working in a coffee shop, clearing distractions, having reminders of what you need to get done, but also change from the inside out. And that might look like, why is this goal important to me? How quickly can I get it done? And thinking of that goal-driven behavior, thinking, oh, how good will it feel when I complete that? And that can provide the increase in motivation.
I found as well gamification has kind of become a big thing in my life, and I'm sure so many other people's as well. But just, kind of like I know there's like multiple apps that will kind of gamify your life, or gamifying tasks as well. I found that really helpful. So I've been finding that quite interesting.
Yes, lots of people will come to me and say, okay, well, there's this app called Finch, or other goals, other apps, and there's so many out there. And I think it's about finding one that works for you.
Yeah.
And once you find something that works, then it's about trying to stick with it. And if it doesn't work anymore, if those usual tools aren't working, it's about thinking of, okay, what else could help in this situation?
Hyperfocus. Is this something that we can trigger, or is this just something that kind of pops up when you least expect it, and you've got to kind of grab it by the horns as you have it?
Hyperfocus is really interesting, because sometimes people may come in for an ADHD assessment and they will meet the criteria on the clinical interview and on the CONAs, and you sit down for the continuous performance task, the QB test, and doesn't show ADHD, and that's a sign. Okay, well maybe you hyper-focused in there, and it can be hyper-focus can be triggered by different situations, and sometimes it's about what is really meaningful and interesting to you as a person. So, for example, if it's gaming, gaming is a really big one, and if you get into that, then it's really hard to disengage. But it can also be other types of projects which are really interesting and personally meaningful to you. I think when that hyperfocus comes, you do want to make the most of it if it's going to be driving you towards something that's valuable. But it's also about being aware of when actually, am I focusing on the right thing? Is it taking me away from the things that actually matter to me right now?
Yeah. So it's kind of looking at maybe what triggers that hyper-focused. And I guess if you want to trigger that hyper-focus, like you can put yourself in that situation, but being aware that maybe that isn't always the best thing to be doing.
Yeah, I think it's really difficult. It's about thinking about what are my goals and what are my values, and thinking about, okay, is this going to move me towards what matters, or actually is this something which actually it might move me away if I'm focusing on, reading my book and I'm really in the zone there, but I know I've got to get those emails replied to. Yeah. Actually, what's going to contribute to more stress in the long term? But of course, if you're really focused on something, it is hard to step away. So it's about finding those strategies and maybe putting reminders or getting some external accountability as well to help with that.
And just before we close up, could you kind of give me your biggest myth that you'd love to bust around people with ADHD?
I think one of those myths is that ADHD is that really naughty boy in the classroom. And of course, swinging on the chair, and actually the myth that this is naughtiness. It's not naughtiness. It's just a different way of a brain working. And I think there's a real positive shift in the narrative of ADHD and autism too, which is recognizing that each brain is unique and it comes with these real strengths. So I think the myth of this being, a naughty young person is a really damaging myth. And when we're able to look at the strengths that come with it, that's a really hopeful message for people with ADHD. But also, it's not about saying, okay, well, there's no challenges. We do recognize there's those challenges, but it's about finding those tools to nurture them whilst playing to someone's strengths as well.
And for those who are maybe listening to this podcast or watching it, who are kind of bells are ringing in their heads, they're going, maybe that does sound like me. What would you recommend being a really easy first step for them?
I think one of the easy first steps is by going online and finding an ADHD screener and just completing that and seeing whether or not that suggests that you maybe do or don't have ADHD. And you can use a tool such as the ASRS. And if that is indicative, then perhaps it's worth speaking with your GP about it as a first step, who's able to point you in the right direction of a practice which is regulated and accredited, who's going to provide that really in-depth, strengths-based assessment.
Awesome. Dr. Bradley, thank you so much for joining us on this episode. I thoroughly enjoyed our conversation about ADHD, and I loved how you kept kind of the positive narrative as well. It wasn't just the things that are difficult, it's also there's real strengths in that as well.
Well, thank you so much for having me, Megan. It's been a pleasure chatting with you as well.
If you enjoyed today's episode, please follow and share Patient in the Room wherever you get your podcasts. We'll be back soon with more conversations.